From the beginning, when this all started, everybody told me that it's a different life for you now. Thank God that I'm here today to talk to you about it. August 26th, and I was walking, and that was it. I went to my knees and to the floor. I wasn't able to move anything and didn't understand why.
As soon as the doctor in the ER walked into the room, she knew that it was something going on with my mom's spinal cord.
Did an MRI of her spine and found that she had what we call an epidural abscess in her cervical spine. It is a very difficult to diagnose condition because usually the symptoms are very nonspecific. So we contacted the neurosurgeon and the neuro ICU doctors at Eden.
This was unquestionably a rapidly progressive life and death situation. We had all of our team standing by when Miss Noack arrived.
I was in a lot of pain. I had no idea what I was up against. I had no idea.
When we looked at the imaging studies, it was clear that there was a progressive abscess pressing on the spinal cord itself within the neck, and that it was moving up toward the brainstem. We thought there was a 1 in 5 chance that she may not survive. We knew that the only option we had was a successful surgery followed by long-term antibiotics.
That was her initial diagnosis of the situation. She would do the best to save her life, which luckily she was able to do that, and in record time nonetheless.
When we received her back from Eden Medical Center, we knew that the work was still needed to continue.
She was stable in the sense she was not on life support, but she was essentially not moving much.
We wanted to get her to a point where she could get some level of functioning back.
That's my girl. Robert, he would come in, he'd check in with me darn near every day. I had no medical coverage when this all started, and he walked my daughter through every step of the way.
She was eligible for Alta Bates's acute rehab facility, which is in Berkeley.
Everything happened so quickly to Kim. When she first came in, I think she was almost in a state of denial of really what was actually happening to her. She needed a lot of emotional support.
Dan became a best friend, a brother, father, mother, whatever I needed Dan to be.
I remember one changing point is when we actually took her to what's called the standing frame. The machine actually stands for them. And I could actually see a transition in Kim where she could actually look at herself in the mirror and she smiled. And her mood changed from that point forward.
She's changed a lot, mentally, physically. It's a horrible experience to have to live through. But to have a team of people that push you and make you want to do things and not just let you go away. And I think that's very important because no matter what, whether your legs work or you don't, you're still yourself.
I do feel that the success of Miss Noack being able to survive this disease, being able to come through, is very much linked to that team approach. We take care of patients like family.